professors, respected seniors, and my dear friends. I am Brishruti of 2023-24 batch, and today I will be speaking for the motion that euthanasia should be legalized. Euthanasia is often known as mercy killing. It's the act of deliberately ending a person's life to relieve them from unbearable suffering and pain. It is not about ending life, but about ending a hopeless agony and with compassion and dignity. So, I members of the House and the glorious ladies and gentlemen who are sitting here. So, today my topic is that euthanasia should be legalized, and I am going to strongly oppose it. Okay, there is no question. So, the first thing is that I will begin with a quote given by Helen Keller, who was herself deaf and blind. She said that life is either a daring adventure or it is nothing at all. Okay, so now what if Helen Keller had chosen euthanasia? Would the world have gotten such a great personality? It wouldn't have. Okay, so next is that, see, it is not about a legal matter. The Supreme Court today gave a verdict that no, all the...
A very good afternoon to present everyone here. আমি এখানে ইউথ্যানেসিয়ার সপক্ষে কিছু বলতে চাই যে ইউথ্যানেসিয়া কি? ইউথ্যানেসিয়া এমন একটা প্রসেস যেখানে আমরা যে পেশেন্ট আছে, টার্মিনাল ইল পেশেন্ট বা ক্যান্সার পেশেন্ট, যে শেষ পর্যায়ে চলে গেছে, তাকে আমরা যন্ত্রণাহীনভাবে মৃত্যু দিচ্ছি। কিন্তু যে কোনো পেশেন্টকে আমরা পাচ্ছি না। আমরা কার্নোস্কি পারফরমেন্স ইন্ডেক্স এবং ইগোর স্কেল অনুযায়ী যেটা 40%-এর নিচে যারা পারফরমেন্স আছে সেই সমস্ত পেশেন্টকে আমরা চুজ করছি শুধুমাত্র ইউথ্যানেসিয়ার জন্য। আবার এখানে একটা ব্যাপার আছে, একজন পেশেন্ট যে হসপিটালে টার্মিনালি ইল পেশেন্ট ভর্তি আছে, ক্যান্সার পেশেন্ট ভর্তি আছে, তার জন্য আমাদের সরকারের খরচা হচ্ছে 40-50 লাখ টাকা। সেই টাকা দিয়ে যদি আমরা হসপিটালের ক্ষেত্রে ইমপ্রুভমেন্ট করি, সেক্ষেত্রে আরও কত ম্যালেরিয়া, ডেঙ্গু বা নর্মাল কমিউনিটি পেশেন্টকে ঘটনা রেখে সেক্ষেত্রে আমাদের হেলথ কেয়ার যে
মেডিকেল ফিল্ডের জন্য খুব একটা গুরুত্বপূর্ণ বিষয়। ঠিক আছে, প্রথমে আমি দুটো লাইন করতে চাই। প্রথমে সেটা হচ্ছে ইংলিশ, তারপরে হচ্ছে একটা বাংলা। ঠিক আছে, স্টার্টিং হচ্ছে যে where there is a life there is a hope। এটা একটা খুব গুরুত্বপূর্ণ একটা কোট। আর আমরা অনেকেই বাংলা গান শুনি, ভূপেন হাজারিকার অনেকের নাম শুনেছি। তিনি বলেছেন যে মানুষ মানুষের জন্য, জীবন জীবনের জন্য। একটু সহানুভূতি কি মানুষ পেতে পারে না? তাহলে আমরা যদি একটা মানুষকে যদি ওই টার্মিনাল ইল পেশেন্টের যদি আমরা একটু সহানুভূতির সহিত না দেখি, তাহলে আমাদের মেডিকেল ফিল্ড কোথায় যাবে? আর একটা ওই লাইন গানের একটা লাইন আছে যে মানুষ
misunderstood the concept of euthanasia. They are combined with depression, terminal illness, cancer, but it is not that. A person can call the euthanasia can only be done when the ECOG scale is less than 40%, and it is the justification and aim survey in the year 2022. 72% of the general public has agreed for the topic of this, has supported the idea of euthanasia, and 68% of the doctors supported this. That person with terminal illness should agree for this euthanasia concept, and I agree with the topic, and I did a slogan that Zindagi badi honi chahiye lambi nahi. It recognizes that life's value not merely lies in the length, but it lies in the quality with which it should be lived. And for a resource poor country like India, who will bear the cost? I want to ask them, who will bear the cost of this patient? Now you are talking about famous personalities, Stephen Hawking. He did not accept euthanasia, and the person like Monisha Koirala. Now what? My opponent team said that euthanasia should be legalized in India because most doctors supported that. Something she gave that 68% doctors supported. Many patients also supported. Okay, so we already, so naturally we will want to escape some painful procedure. Doctors will want to reduce their burden. We all want to reduce our burden. And next is that many patients, they are saying that they want euthanasia, and the suicide rate in India is also very high. It's not at all low. Okay, so next is that she said that who will bear the financial burden of the patients? Okay, but see, this is a theoretical thing. In practicality, what will happen? I said that patient's relative will want to extract insurance money out of the patient. That if a patient dies, I will get the money. So I get property, something like that.
Patient can be quote unquote killed. The patient can be euthanasia. Now, if the patient is able to give his or her consent that I am not willing to live anymore, then this is called the voluntary euthanasia. Now in medicine, only this voluntary euthanasia is actually very much permissible. Non-voluntary euthanasia is when the patient cannot give the consent. Patient is not able to give the consent. Suppose a patient is suffering from stroke, where the irreversible brain damage is there. The patient cannot give the consent. So it is called the involuntary euthanasia. It is for non-voluntary euthanasia. Next is the involuntary euthanasia. It is involuntary. The patient is not given the consent. It is without the consent of the patient. We are killing the patient. So that is called the involuntary euthanasia. Now come to the active and the passive euthanasia, where the doctors are pushing some injection to actively kill the patient. Or this is called the active euthanasia, or the passive euthanasia, where the treatment which is supporting for the living of the patient, the life support, the life care support, maybe the ventilator, maybe some drugs, maybe some insulin, maybe some nutrition, maybe some glucose, maybe some injections, so all these things that has been withdrawn. That is called the passive euthanasia. So we are now having 5 types of euthanasia: voluntary with the consent of the patient, involuntary without the consent of the patient, non-voluntary where the patient cannot give the consent, active where we are using some injection to kill the patient, not any poison. Mind it, we cannot put any poison to a patient's body. I can only put some injection which is not actually a poison, which is a drug actually, not a poison, is used for a purpose of euthanasia. And the passive euthanasia where the end of care life support is being withdrawn. Now what is the status in India? In India, as per the Supreme Court law, active euthanasia means where you are putting some injection to kill the patient. That is illegal. In the court of law, you can have the passive euthanasia in certain situation, and with that certain situation that should be validated by the court of law. If the patient is telling that I want to die, I do not want to live anymore, and the doctors decide yes I can offer the death, then that is not sufficient. There should be some system in any modern society. We are not living in the primitive world. We are not even living in the medieval age also. So I am willing to take some. I have taken some bank loan and I have